So this explainer project is going to be on the rate, what a rate is. Rate is a number of events or cases that occur in a population in a given period of time. That's the definition of a rate. Cases equal the people who have the disease, injury, or death. Population at risk is the number of people who are susceptible to the disease or event in a specific time or period. Rate is the number of cases, okay? Those people who have the disease or injury, right there, divided by the population at risk, okay? That is considered a rate. So you're basically creating, if you could think about it, you have 5 people who are sick, and you divide it by the population at risk. Let's say 5,000 people in that population. You divide it, you get the decimal, it becomes a rate, okay? Now, rates are really important to compare groups. You cannot compare groups simply by the case count, like how many people are sick. You need to create a rate to consider the population. So let's say you've got the population of Los Angeles, right, who's got millions and millions of people who have a number of cases that come in. They're going to obviously have more cases than, let's say, a smaller population is. You need to create a rate so you can compare what's happening in Los Angeles to a smaller population. You create a rate. So rates allow you to compare. So let's see, North Dakota here has a population of let's see here, I'm going to click this, of 51.6 per 100,000. What that means is they took the number of people, number of cases, and I could switch this to number of cases, and they divided by the population, which is 762,000, okay? So the number of people who are sick divided by this population gives you this rate right there. And do you see these rates? I mean, Montana has a population of 1 million, and you can see their rate at 34 per 100,000. So rates create this ability to compare. Rates are important. And why they're important? Because rates and ratios are key to cornerstones in understanding health, morbidity, and mortality of populations. Plain numbers of events such as deaths or births or hospital admissions have very little meaning in themselves. So if I just tell you there were, 1,000 cases of something at a certain hospital compared to another hospital that had 500 cases, the first question you would ask me is how many people are in the hospital, right? Because it could be a small hospital and that has lower case numbers. You don't know until you have the population. So for example, 250 deaths in Los Angeles with a population of 3.99 million compared to 250 deaths in Jefferson County with a population of 24,192, you would see that Jefferson County has a higher rate. Because when you do the math, when you do 250 divided by 24,192, the rate will definitely be higher than compared to 250 divided by 3.99 million. And so one of the things that I'd like to show is that rates are often expressed in 1,000, 10,000, or 100,000. And numbers of births are often compared, that they do something called mortality rates. And they compare the rates of births, but they also compare death rates when they create infant mortality rates. This is an example. I got this from the Kaiser Family Foundation. You'll see right there, California. This is the number. If you look at the number right here, I've clicked on the number, and you'll see that based on this number, California, right, in this chart, has 371 counts of infant mortality. Black or African American, 190. Hispanic, 906. Other, 302. And that other is a catch-all of all these other different communities kind of all thrown into that one other. So it's not broken out, but it gives you an idea. These are the case counts, right? When I look at the next one, it moves to a rate. And what that means is they took the total population of California and they divided by the number of deaths and it made a rate. So before, those numbers were higher because California has a higher population. But when you look at those rates, you could start to compare and see that actually Arkansas has some higher rates than California. See, what it does is it takes in the population. And they did this per, I think it was per 1,000. So that means that they did the rate and then they times it by 1,000 so they could get to these numbers that are easy to compare and use. So there are 3 different types of rates that you often see in public health. And I'm going to circle the keywords here. For incidence rate, focus on the word new. So that means that you have to back out people who have been sick before to focus in on only the new cases. The prevalence rate looks at everybody. Everybody who's been sick before, plus the people who just got sick. And often you'll see prevalence rates used for chronic disease, like 30% of the population has diabetes. So look at the total number of all individuals, people newly diagnosed with diabetes, and those people diagnosed in the past from diabetes. And then it divides it by the total population in that community at risk of having that attribute at the time, and that becomes the prevalence rate. And the incident rate, again, focusing on new. So I really like this last slide because it shows us new cases coming in. And think about this water coming in. New is incidence. So if I have a lot of new cases coming in, that shows me the rate of infection and how fast people are getting sick or what they're getting sick of. And I can track that. So I'm looking at new cases here, new incidence. Prevalence takes a look at all the cases, both new and existing. And this could have been over a lifetime period, a period prevalence, but you're taking every case in account. And so when you look at new cases, you have to back out the prevalence, okay? You have to back out the existing cases to only look at new cases. So when I say new cases, you think incidence rate. When I say prevalence rate, you're thinking about all existing and new cases together. Often I see incidence rates used with infectious disease because we're looking at the rate of infection. And prevalence rate is often used with chronic diseases like diabetes or asthma or heart disease because you can grasp to see what the disease burden is across the community with prevalence rates. And then the one I didn't go over that's not in this graphic is attack rate. And it's the same idea of an infection rate, but it just expressed in a percentage. So that is a summary of different types of rates and why they're so important. We need to understand our new cases coming in and what existing cases are out there already with our incidence rates, new, prevalence rate, existing, and new together.